I'm an assistant professor at the University of Michigan, Flint. I work I teach and do research in public health and health sciences, and my research is mostly in healthcare policy. For me, it's a two-pronged approach when it comes to healthcare research. Not only allows me the opportunity to bring students into maybe something they haven't considered. I think there's a lot of opportunity for students to do what we do, but also to at least start to develop an expertise that influences policy about things that we really care about. I particularly study end-of-life care. I believe that care is a spectrum, and you're as important from the moment you're born to the moment that you're not here any longer. And I sort of frame that policy in a way that trying to kind of maybe get some of the stigma away from death and dying. For me, it was very personal because a family member very close to me became ill very suddenly, and they were given 2 weeks before they died. And I was able to be there for the family member, but also see firsthand what a great job people that took care of you at that stage did. But also made me a critic because I could never forget how I manage organizations and what I have learned. And I saw things that I was uncomfortable with, even though they were very well intended. And that sort of raised the question to me, we really kind of on a huge healthcare highway, and the moment somebody becomes terminal, they take an exit, and we hope for the best. Great care is provided, but I had lots of questions about how is this regulated? How do we manage it? We, as a nation, are struggling with the right to die and the right to live, and we have a very unique hybrid, but at the end, we have chosen to finance choice, which is you choose to receive end-of-life care at home or in a facility. But more importantly for me is, are we getting what we intended? And is that the best we can do? I think the most important thing is, how do we finance this system that can in some way address the need of the majority, yet not becoming a policy that is so rigid that eventually is useless and more expensive. We really have always modeled the individual, or tried to model the individual because of the economics of policy, but now we're learning that maybe that's not the best approach, and maybe sometimes that has been expensive. You have to run Good Morning after an illness that maybe, or maybe a condition that maybe was not clearly understood. There's an energy here that most institutes wish they had. It's amazing to me to see an organization that can sustain that kind of engagement and that kind of excitement, and that's contagious, and that's what I like coming down here from Flint. I think that IHPI can help me with my training. It can help me polish my skills so I can be a better researcher, but also a better ambassador for the university. It helps me to reach a level of my career that I probably couldn't do otherwise because of all the tools and resources in place. When I look at the future and I look about our impact and my impact is to maybe bring to the process something that I feel has been lost. I think over the years, the influence of universities have been lost in the political process. We already have shown that we, as an institute, can be at the table and be influential, and that's one of the things this organization wants to do, and I'm not sure that all centers or institutes have that benefit. So I think there's an alignment here that is very exciting, and I think that in the future we'll look back and see that there was an impact.